friendly fire from your fabulous verbal family, diseases you can catch from your pets. Hello and welcome to the channel. Naturally, as a GP, general practitioner, and emergency room doctor, I see many wounds and injuries, and indeed diseases inflicted by the sweet little family pet. Looks like an angel, but is the harbinger of potentially lethal illness. But alas, the cuteness overload, über alles. It was a new statistic for me to learn that over 66% of United States households have a pet, and that comes to 86.9 million households, according to Forbes Advisor. And I bet 86.9 million households would be willing to take a bullet for the family pet. We love them to death, don't we? I have heard from multiple patients of mine that they prefer animals to humans. I can't say I'm surprised. So, what kind of friendly fire do we subject ourselves to from our family members from the animal kingdom? What common diseases do they unleash on us whilst we engulf ourselves with their friendship, company, cuteness, and, well, animal charm? For each disease, we will discuss the bug responsible, usually a bacterium, virus, or fungus, how it can pass from your pet to you, the typical symptoms to expect, and how to prevent this happening other than giving away your pet. Let's start with cat scratch disease. The causative agent for this is a bacterium called Bartonella henselae, typically transmitted through scratches or bites from infected cats, especially kittens. And the symptoms include swollen lymph nodes near the site of the scratch or bite, fever, fatigue, and headache. In severe cases, it can lead to complications like encephalopathy, brain inflammation, or neuroretinitis, an inflammation of the back of the eye. Treatment. Cat scratch disease can sometimes resolve on its own, but if it leads to infection, then an antibiotic is required, like azithromycin. Prevention measures include avoiding rough play with cats, especially kittens, who are so boisterous and gorgeous. But do be careful with them because, of course, they're learning the ropes of how to be a predator. So biting and scratching comes naturally to them. They don't mean no harm. And if you do get scratched or bitten, clean the wound immediately, wash it with water, disinfect it as soon as possible to prevent infection. Leptospirosis. The causative agent for this is a bacterium called Leptospira. The transmission is through direct contact with urine from infected animals or contaminated water or soil. Dogs are common carriers. Now, I didn't know this before I started researching this topic. The textbooks I read in medical school always spoke of infected rat urine being the culprit. Hence, never swim in waters that could be infested with rats. That was the advice that I knew to give my patients. So it's news to me that dogs are also common carriers. The symptoms range from mild flu-like symptoms to severe illness, including liver damage, kidney failure, meningitis, and respiratory distress. Antibiotics like doxycycline or penicillin are quite effective, especially if They are administered very early on in the disease process. Prevention involves vaccinating your pets, avoiding stagnant water, and using protective gear when handling potentially contaminated materials. Salmonella, or the disease itself, Salmonellosis. The causative agent is, of course, Salmonella bacteria. People can get infected through direct contact with infected animals or their feces, or indirectly through contaminated food or water. Reptiles, birds, and amphibians are common carriers of this. Symptoms include diarrhea, fever, abdominal cramps, and vomiting. Most cases resolve without treatment, but severe cases may require antibiotics and rehydration therapy, and the most sensible way to do this is to admit a patient to hospital. Through hand washing after handling pets or cleaning their habitats, we can prevent Salmonella, and of course maintaining proper hygiene in pet areas. Viral infections. Rabies. Causative agent is the rabies virus. Transmitted through the saliva of infected animals, typically via bites. Dogs are the most common source globally, but also cats, bats, and other mammals can transmit rabies. Now, this is something I didn't know, that cats, especially cats, can transmit rabies. I never heard this before, but it's true. Early symptoms are non-specific, including fever and headache, but it can quickly progress to neurological symptoms like agitation, hallucinations, and paralysis. Rabies is almost always fatal once symptoms appear. Now, this is very important. It is a killer disease, so it's vital to recognize that rabies is involved here, and this very often involves recognizing which dog is rabid and not wait for symptoms to appear in the human. Treatment. Immediate post-exposure prophylaxis with rabies vaccine and immunoglobulin is crucial. Just get to your GP as soon as possible or to your nearest emergency room and get vaccinated, not only against rabies, but also against tetanus. Don't forget, you also need a jab for tetanus from bites, including human bites. But the first thing to do is to wash the wound and, if possible, disinfect the area. Prevention: vaccinating pets against rabies and avoiding contact with wild animals, especially unknown dogs. Strange dogs are essential preventive measures. Strange dogs or cats, I should say. The next one is a fungal infection, ringworm. Causative agent, dermatophytes fungi, such as Microsporum canis, Trichophyton mentacrophytes. Transmission is with direct contact with infected animals or contaminated surfaces. Cats, dogs, and rodents are common carriers. Ringworm appears as a red, itchy, circular rash on the skin or scalp. In animals, it can also cause hair loss and scaly patches. Treatment: antifungal creams, ointments, or oral medications are effective. Prevention: regularly cleaning pet bedding and grooming tools and isolating infected pets until they are treated can all prevent spread. Parasitic infections. Toxoplasmosis. Causative agent, Toxoplasma gondii. Transmission, humans can contract toxoplasmosis through ingestion, so eating of the oocysts or the eggs from contaminated soil, water or food, or through handling cat litter from infected cats. Symptoms. Most people are asymptomatic, but some may experience a flu-like illness. In immunocompromised individuals, so anyone whose immune system is a little bit weakened through chemotherapy or medicines or illnesses such as AIDS, HIV, it can cause severe complications like encephalitis, brain inflammation. This next part is very important if you are a woman of childbearing age. Congenital toxoplasmosis can result in miscarriage or birth defects in your baby. Very important. If you are pregnant or wishing to become pregnant, please avoid touching or coming into contact with cat litter. Treatment. This includes antiparasitic medications like pyrimethamine and sulfadiazine. Prevention, proper hand hygiene, cooking meat thoroughly, and avoiding handling cat litter during pregnancy can reduce the risk. Echinococcosis. Causative agent, Echinococcus tapeworm. Transmission. Humans can become infected by ingesting eggs from contaminated food, water, or soil, or through direct contact with infected dog feces. Symptoms. The infection can cause cysts in the liver, lungs, and other organs, leading to symptoms like abdominal pain, nausea, and cough. Treatment options include surgery to remove the cysts and antiparasitic medications like albendazole. Prevention, regular deworming of pets, maintaining good hygiene, and avoiding feeding pets raw meat are important preventive measures. Scabies. Causative agent, Sarcoptes scabii mite. Transmission is with direct contact with infected animals like dogs. But I have to say the majority of cases are actually human-to-human transmission. Symptoms include intense itching and a skin rash, which is shown. Treatment, topical scabicides and oral medications are pretty effective in treating scabies. Prevention is simply avoid contact with infected animals and maintain good hygiene. Giardia. Giardiasis is actually a very common cause of diarrhea, even in temperate climates. I never really thought of it as a problem you can get from your pets, but there you go. Apparently it is. Giardia is a protozoan, a bug which is neither bacteria, virus, fungus, or worm. They are very simple organisms with only one cell. What I find interesting with Giardia is that it seems to have a face. Causative agent, Giardia lamblia. Humans can contract giardiasis through eating, ingestion of cysts from contaminated water, food, or surfaces. Dogs and cats can be carriers. Symptoms include diarrhea, abdominal cramps, nausea, dehydration. Treatment is with antiparasitic medications like metronidazole, which is also an antibiotic. It also works against bacteria, or tinidazole. Prevention is practicing good hygiene, ensuring clean drinking water, and avoiding any consumption of potentially contaminated food. Last but not least, let's take a quick look at the flying furballs, the birds. What can we get from birds? The biggest medical issue with household birds is lung disease. Well, the most famous one of all has also the prettiest name, in my opinion. Psittacosis, often referred to as parrot fever, is caused by the Chlamydophila psittaci bacterium, not to be confused with chlamydia, which is of course a sexually transmitted disease. The bacterium is usually contracted from infected parrots, but pigeons and sparrows have also been responsible for transmitting this disease. Infection occurs through inhaling airborne particles from respiratory secretions, dried feces, and feather particles from infected birds. After an incubation period of 5 to 19 days, the symptoms of the disease begin to show, which range from basically nothing, asymptomatic infections, all the way through to severe pneumonia. In the first week of psittacosis, the symptoms resemble those of typhoid fever, like abdominal pain, headache, fever, and diarrhea. Treatment: tetracycline antibiotics like doxycycline can be used to treat psittacosis. Quinolone antibiotics like levofloxacin and moxifloxacin and the macrolides like azithromycin are also effective. Prevention, as ever, hygiene, and mask wearing if you are prone to respiratory or lung infections. And there we have it. Pets bring us so much joy, companionship, and healthy lifestyles. For example, if you have a dog, you need to walk them, and that takes you out of the house. It makes you go out walking, exercising. Pets need their own medical care, of course. Hopefully, they will have a vet looking after their medical needs. And you need to take care of your health too, with respect to your risk of catching something from Fluffy. What are your experiences with pets in your home? Have you caught something from a pet? Have you come to serious harm from a pet or a stranger animal? Do tell all. Let's take a break from human medicine and talk about our furry friends for a change. If you are a vet, please take my place for this video. Everyone, please address yourself to the vets amongst us. Go on, ask a vet.